Hi, I'm Gil Kennedy, President and CEO of Har-co Credit Union. Today I'm here at the Leary Addendum, and I have the pleasure to talk to Ronya Nassar,
Yes.
who is a health policy analyst at the Harford County Health Department.
Yes, that's
Welcome,
right.
Ronya.
Thank you. Appreciate you having me today.
Ronya, this is very apropos in that, the whole basis of our podcast have been around educating our membership and the community at large about COVID. You're with the health department, so you're the expert as it relates to understanding COVID and the implications of that from a health perspective. So we're so happy to have you.
Thank you.
So I know in our discussions before we went on to this podcast, you talked about how oftentimes you get phone calls from the community about, I have this symptom and that symptom. So talk to me about the symptoms of COVID and how the health department really can frame thought in people's minds about what's going on with themselves as well as what's going on in the community.
Yeah, of course. So I just want to give a little kind of quick background. So I know a lot of people say COVID-19. You can see where it's like SARS-CoV-2. Sometimes you see novel coronavirus. So kind of just starting with like the basis, SARS-CoV-2 is actually the name of the virus that causes COVID-19. So viruses and diseases, they often have different names. So we usually, for example, HIV and AIDS, so that's like another example of that. So just kind of going back from just like the beginning, so I might be using a lot of terminology. I might say SARS-CoV-2, I might say COVID-19, I might say novel coronavirus. Generally we see COVID-19. So first, anyone can have mild to moderate symptoms, and symptoms may appear 2 to 14 days after you've been exposed to the virus. So I'll give a little plug about the 14 days a little later on. So again, 2 to 14 days after someone gets exposed. Those symptoms that can appear include sore throat, fever, chills, fatigue, body aches, muscle aches, new loss of taste or smell. That's a huge one that people have been seeing a lot with some of the younger population. Sore throat, congestion. Really long list you can actually find on the CDC website. So that can get a little confusing for people because they always say, oh, this is, everything I have sounds like COVID, but it's really important that just to kind of stay home and monitor your symptoms. So if you wake up and you aren't feeling okay one day and maybe you have maybe 1 or 2 symptoms, I wouldn't assume that, it might be just the allergies or, I'm just, feeling a little off today. It's really important that we educate people when they call us to say, hey, if you're not feeling good today, stay at home, rest, monitor your symptoms, because you may not know. And then if they are having symptoms, it's really important that to go out and kind of talk to your provider, talk to your doctor and see, hey, I have these symptoms. Do you have any other suggestions for us? Should I go get a test? So that's really kind of the basis of what we tell people when they do call us.
So I wake up, I feel run down. First off, I probably shouldn't go to work.
Yes.
Correct? And shouldn't go out in the community.
Yes, that is correct.
See where my symptoms go, call my doctor if they progress. Understand that people generally don't lose their taste or smell, which is a significant symptom. Is that correct? Or
yes, that's correct. There has been studies that showed that new loss of taste or smell have been coming up with a lot of people. So that's also another symptom that if you do lose your sense of taste or smell, definitely stay at home. And you may not have any other symptoms but that. So again, the symptom, it's really important to, like you said, monitor when you wake up in the morning, monitor throughout the day.
So the measures that the community should take as it relates to not spreading the virus.
Yep.
Talk to me a little bit about that.
Yeah, so first off, again, stay at home if you're sick. That is the first and most important measure. The other one is wash your hands often. I know we say that, but wash your hands for 20 seconds a day. It's the simplest thing we can do, yet some people don't remember to do it. So washing your hands. The other one is to, if you can, while you're monitoring your symptoms, you can take your temperature. That's really important. And then again, wear your mask. That's the other question we get a lot lately. Do we have to still wear a mask? This is where we're at right now in stage 3, or hey, I'm just running out to the grocery store. We have masks for a reason, and that's so So I can protect you and you can protect me. The mask provides a barrier. So as we know, that research shows that COVID-19 can be spread through respiratory droplets. That cloth face covering your mask protects as a barrier so that we're not spreading our respiratory droplets everywhere. So regardless, if you are at high risk, if you are not at high risk, if you are any age above 2 years old. I know in Maryland specifically, we're saying if you are age 5 and older to wear a mask, and that's in the governor's executive order. Wear your mask.
Well, it's so important, and we as the community, I think, owe it to ourselves, each other, and
Yes.
certainly to our families and friends. And there's so much news out there, and it can get kind of overwhelming for
Yes.
I know for myself, particularly as we as a community began to understand what this virus was all about and how it spread.
That's true.
But it seems to me that simple steps can have significant implications, i.e., wearing a mask, socially distanced. By the way, we're 6 feet apart.
Yep, 6
I
feet
measured
apart.
it. And we're outside.
Yes, that's true.
So obviously, you still can be in those situations where you're outside, not wearing a mask. But if you're in a crowded situations, I think it's a risking, and the higher the actions that you take can increase the risk of you contracting COVID-19.
And that was actually a really important statement that you said. Even if you're outdoors, and there can be opportunities where you are outdoors and you are 6 feet apart, and there's a reason then you don't need to wear a mask. But if you were at an event that was outside and it's really hard to be 6 feet apart from people, that's really important then again to wear your mask.
Right. And it could be, the surgical mask. It could be homemade masks.
Yes. So one thing I want to mention is that I know a lot of people ask us about the N95 respirators, and it's really important to note that N95 respirators are really important to stick to the healthcare professionals. Those are the people that really need to be wearing those types of masks. The other thing too is that the N95s are actually meant to be fit tested for healthcare professionals so that they could wear them properly. So I know a lot of people are like, oh, well, like I see an N95 here and N95 on this person. Really keep those out to the healthcare professionals. There's also confusion because you can see on Amazon they have KN95 masks, and those aren't really technically considered the real N95 respirators. So again, really important to educate yourself, and you can find all that information on the CDC website.
I see a lot of people when I go to Home Depot or Walmart or whatever, the store, wearing a mask under their nose. So is that an appropriate way to wear your mask?
No, that's not. So the really important way to wear your mask is to make sure that it really covers your nose and your mouth and it fits snug to your face. But you also want to make sure it's breathable material. So they say 2 layers of breathable material that covers your nose and your mouth, and it fits snug to your face. So you're not having any type of respiratory droplets spread outside.
I noticed that driving around, I see people driving with their mask hanging from their rear view mirror. It's important to wash your mask, correct?
Yes, so especially if you have a cloth face covering, we really recommend that you wash your mask often. And the CDC suggests that you could throw it into your laundry, try to use warm water, and then also if you can put it in your dryer at high heat too as well.
Right. Now, the flu season is coming up.
Yes, it's a big one.
So talk to me about, obviously the symptoms of the flu could be the same as COVID-19. So how do people protect themselves from the flu? And obviously we don't have a flood of testing going on for COVID when we should have prepared for the flu as well. So talk to me a little bit about that.
Sure. So first off, I want to say that the most important way that you can prevent yourself from getting the flu is getting the flu vaccine. That is the first most important way. I know a lot of people probably, right now, I want to say that vaccinations, we've seen a little bit of a slight low in vaccinations, and this isn't just with the flu vaccine, this is with childhood vaccinations as well. And I know the health department's really pushing for parents to make sure that their kids are up to date on vaccinations. Now that we're heading into flu season, flu is also another vaccine we also need to make sure everyone's up to date on. So it's really important that we take time to contact their care provider and see, where if they're offering the flu vaccine, where they can get it to as well. Another thing I want to say about the flu is one thing that's really important is that because of COVID-19, we put a lot of measures in place. And one of the important measures, like we mentioned, if you feel sick, stay at home. So this is going to go along, it's great that we already have that going along with the COVID season right now. So it goes along with flu. If you feel sick, stay at home so we don't prevent another influenza virus spreading throughout the community too as well. So really important, get your flu vaccine.
Get your flu shot.
Yes.
And I would imagine that, if you wash your hands
Yes.
and you wear a mask, that should have some positive implications to preventing the spread of the flu virus.
Yes, like I said, we have all these already non-pharmaceutical inventions, they say, in place. So it's really important that we continue to carry this over into the flu season as well.
Right. Well, yesterday Governor Hogan came out with phase 3 of
Yes.
his roadmap to recovery.
Mm-hmm.
And, again, whether it's phase 3 light or entering into phase 3, obviously we're all feeling our way, and, the governor has done a wonderful job in driving down the positivity rate, and our positivity rate in Harford County is, it's been
Great.
very good.
Yes, I would have to say that, Harford County has been doing a great job. And again, this is, could be evident to social distancing, those non-pharmaceutical interventions, washing our hands, staying 6 feet apart. So with the phase 3, so what is new now, starting September 5th, which is Friday?
Right.
Yeah, so moving performances, there can now operate at 50% capacity, or up to 100 people indoors, or 250 people outdoors, whatever is less. And then for retail and worship, they can move from 50% capacity now to 75%. The other thing to mention is just because we're in phase 3 doesn't mean that you have to do something. If you feel, you have to feel whatever you feel comfortable with is, how you should be able to live. So if just because we have, retail at 75%, if you don't feel comfortable walking into a place, that's okay. You shouldn't feel pressured to have to do something, but we also remember that, we have a lot of good practices in place so that we are able to open for stage 3.
Yeah, and I think that, obviously running a financial institution, we, all our people will continue to wear a mask. We have plexiglass up.
Great.
We wipe down surfaces routinely. And, it is not our normal way of operating, but, we're still providing services to our membership and to the community. But again, I don't think that moving into phase 3 means, well, we take all that stuff down,
Yep.
we stop wearing masks, and we stop washing our hands.
Mm-hmm. Yeah, that does not mean that everything we've been having in place goes away. It just means that, we have a little bit more opportunity for us, but we still need to wear a mask, wash our hands, monitor symptoms, all the important things that we've already had in place. And another thing is that, the health department is really, we're really focusing on educating businesses to make sure that they do remain open during this time. So we do have a website, a webpage on our website at
And what's that website?
www.harfordcountyhealth.com.
Okay.
We have a stage 3 open for business website, and on that website we actually have education that businesses can look at, and we even have ideas for if they need signage outside, symptom checkers, things like that, just to kind of educate them. They could always look to us for that.
Well, those signs are really important. I know we post them on our doors, and it's just a constant reminder of what we should be doing.
Yes.
And I know myself, I can tell you, when wearing a mask became a way of life, I had a couple times I'm walking inside, and I'm like, oh my gosh, I forgot my mask. I go back down and put it on. But it happens. But we all owe it to the community and to ourselves that wear the mask. It's no big deal, and let's get this thing over with.
It's a new normal for us, and the one thing I do want to mention is that we need to kind of help normalize this with our kids. Parents should help normalize it with their kids, just so that it is something that they are used to. And it's sometimes kids can feel a little confused during this time. It's really hard to explain a pandemic to children. So kind of if you can, adults and guardians, if you can kind of help provide them that new normalcy, that might help with, how children kind of perceive this time.
Right, right. Now, speaking of children, and I know, the world changed the week of March 16th, at
Yeah.
least in the United States and Maryland in particular. It was, in some aspects for some people, there's a lot of isolation effects.
Yes.
So talk to me a little bit about the mental health side of it as it relates to COVID, and what are some of the resources available to the community?
Yeah, so it's no doubt that, a lot of people can feel lonely at this time, especially when, our main focus is on social distancing. And so I will like to say that, the most important thing is to really check up on people and provide that connection. One of the lowest risk things that you could do during this time is virtual conferences, picking up your phone, texting people, calling people, just say, hey, thinking about you. So I think that's a really important thing that we could do. The health department also has a link on our website too as well, where people can access certain resources during this time if they are having some mental or behavioral health issues. We have the Klein Family Harford Crisis Center here in Bel Air, and if you have a medical crisis and you do need help, we really suggest people to call 1-800-NEXT-STEP, and the Crisis Center is here as a huge resource, and how lucky are we to have this here in Harford County.
Well, that's a tremendous resource. And, when I interviewed Police Chief Moore of the town of Bel Air, I asked him about the opioid epidemic that we had, and it sort of went to the, back of the pack as it relates to topics that we all were thinking about trying to deal with in light of COVID and some of the other aspects we're dealing with. But, that according to him, that epidemic is still going on, and they're still seeing signs of it. And I know the health department, looking at your website, you do talk about resources available to people that are feeling isolated and perhaps turning to other substances.
Yes, I know we might seem like this is all we're concentrating on is COVID, but the health department is still very much so dedicated to every other health aspect in our community. So we want to make sure that, people are getting the help that they do need.
Well, I know you've been super, super busy, and what a tremendous resource. I'm sure, I'll be honest with you, I really didn't think about the health department all that much prior to this, COVID-19 event. If I needed a birth certificate or something like that, I would think about the health department, or to get my passport. But I tell you, I can only imagine what it has been like, and how fast information is changing, and just trying to understand. We haven't talked about vaccines or anything like that. I mean, I've been doing some reading on 17 to 20 vaccines in phase 3 trials. Is that the way that this ends, with the vaccine, or is it?
That's a really good question. So, also too, just the vaccine, there's going to be certain processes. We're not really sure what's going to happen. But again, just because a vaccine comes about doesn't mean that we shouldn't also, practice physical distancing. Washing our hands is always going to be here. That's always going to be the most important thing too, as well. So, hopefully, there is going to be a vaccine soon, but how that's going to change, we're not really sure yet, and how that's even going to roll out, we're not really sure.
Who gets it, and when does it occur? So, no, I would agree with you. I mean, one of my previous jobs, I rode the subway a lot down in D.C., and I wound up getting pink eye. And my kids are older, and I'm like, how do I wind up getting this? And I sort of figured out I got it on the subway down in D.C. So I made it a point of washing my hands and not touching my face. And to be honest with you, even though I did get the flu shot, it benefited me a lot.
Yes, of course. And I want to say, the flu shot, again, best way to prevent ourselves, and washing our hands is also really important too as well.
Well, that, as well as, and you mentioned something that I at least want to bring up, is the importance of vaccinating your kids. And also, a lot of people have, when COVID came out, they didn't go to the hospital, didn't want to have checkups. People need to continue to do that, because the unintended consequence of not doing that is we'll see rises in other aspects, other health issues.
Yes, that's true. So, as you mentioned, right now people might be hesitant to go to the doctors, and I want to break that hesitancy, and it's really important that we also want to prevent misinformation at the health department. Vaccines are right now the safe and effective way to prevent, things from spreading measles, something like this. We haven't talked about it in a long time, but we can see resurgence of it. So, as we see, schools are also beginning to open. We don't want to go away from our also other public health measures that we have been focusing on even pre-COVID as well.
Right. Ronya, I have really appreciated your time and the information that you provided. I generally like to leave these podcasts with an opportunity for our guests to leave us with some thought or perspective as it relates to, what you're seeing, the time that we're in, etc.
So I really just want to tell people that, we are in a really odd time, but I want to, reassure people that spend this time with your family, check in on your people, check in on the people that you love and you care about, and really just wash your hands, stay distant, stay at home, monitor your symptoms, and, this too shall pass. So thank you to everybody who's been, taking their part in preventing COVID-19.
Thank you.
Thanks.
I want to remind everyone, my members and the community at large, to, once you view this, share it with your friends and family. I also would like to put a plug out for the Liriodendron. This is a beautiful facility here. They have Sunday concerts once a month and other events. I would encourage you to go to www.liriodendron.com and check out their activities here. Thank you.